and playing my angles. Or I could have just stayed in the belly button the whole time, and did my cecum, I did my hepatic flexure, liver and gallbladder, then I would have just angled up towards my xiphoid process. If you're dealing with somebody who has a hiatal hernia, and like I said, they have that stomach popping up through their diaphragmatic hole and they have tissue here, they're going to be angling down always when they're doing this area because they're trying to pull that stomach back down through the diaphragmatic hole and get that stomach trigger relaxed. So if I didn't have a hiatal hernia, you can come up and down into it, but if I had a hiatal hernia, always down. So I'm in the belly button, now I'm stimulating up towards my xiphoid process. And as I'm working this area, it's always constantly on the small intestine anyways, because it is in the belly button. Then I'm gonna angle towards my left set of ribs. That's gonna be the splenic flexure, spleen and stomach. Then I'm gonna angle down towards my sigmoid, the last turn. A lot of people will have a little bit of irritation and pain here, and that's like, once again, where you can lift it up, place it in that area, and work that sigmoid out, because the sigmoid can be kind of folding over on itself. It can be ballooning out depending on how much waste is in there, or like gas from that toxic waste with the gas rising up. So after I worked down along that sigmoid area, once again, if I stayed in the belly button, then you can just finish off angling down towards your pelvis, bladder, ovaries, prostate. Okay. So belly button therapy should be done first thing in the morning, like I was saying, just to kind of get this activated, started, like really, like make that feel alive. Stay in your breath. Try to get your breath. As I'm staying in my breath, I'm trying to get my oxygen all the way down to my core to activate it for the day. Like I said, I'm going to spit to get that bad bacteria out of my mouth. Go brush your teeth. Then a nice warm glass of water with some lemon to alkaline the body. That would be like the perfect way to start your day. And then you're going to do it before bed, because once again, it puts you in the parasympathetic, so it will relax your nervous system. You'll fall asleep a lot easier. But belly button therapy, super fantastic for yourself, to energize yourself, to keep those adhesions not from sticking together too hard, keep things flowing properly, and then it's amazing for the clients as well. Do we have any questions on belly button therapy? Okay, I'm going to move on to clapping. Clapping can be done with your hands. The thing is, if you're going to do a lot of clapping throughout a day, I'm going to get a clapper, because my hands do get tired. But I think it's amazing to clap with your hands, because you're getting stimulation to another side of your body. You're stimulating other meridians within your hands. So clapping with your hands is totally welcome as well. But our clappers, on one side, they have these little nubs, and then on the other side, they're flat. So generally, if I'm wanting to just stimulate an area, like if I had like a spot of eczema, or if I was clapping my face, or if I was clapping my breasts, I am mostly going to use the flat side just to stimulate a lot of circulation to go to the area to hopefully eat up or change some of the cellular structure of whatever is happening. If I have an area of calcification, like my knee always gets irritated, or my low back, or my hip is pretty, like there's limited range of motion, I know that I can't do what I normally used to be able to do, so there is some calcification around the joint. We always want to start with the nubbed side then, because the nubbed side will go in and they'll slightly break up a little bit of the fibrous tissue that's built up underneath the epidermis layer of the skin, and then you're going to flip it over at the end and finish with the flat side to stimulate more circulation going to the area after we broke up a little bit of the fibers with the nubbed side. You can't clap over close. I'll do my knee right now, but you can't clap over close just because you're not getting the same stimulation as you would. So clapping over close, you're just hitting yourself. And when people say, I'll have some of my clients be like, oh, I clapped like my hip, my shoulder, my chest last night. And I was like, you clapped for an hour and a half? And they're like, no, like 15 minutes. You can't clap just like a couple times and that's it. At that point, it is just slapping yourself. We want the constant stimulation while we're clapping to really vascularly flush that area. So when I clap, if my knee was calcified, I'm going to start with the nubbed side. Any larger area, like my wrist and hand, that's going to be around 10 minutes, 10, 15 minutes. Any large area should be clapped for around 20 to 25. So if I was doing my knee, that's going to be around 20 minutes. I want to start with the nubbed side, and I'm going to do about 10 to 15 minutes with that nubbed side. And then I'm going to finish for about 5 minutes with the flat side to stimulate more circulation going there. So as I'm sitting, I'm not clapping to the point of excruciating pain, but like it stings right now. It's slight discomfort. And I'm working all around the knee. And if I need, like if I feel like this section is getting like a little raw and I need a break, I'm gonna head on over. Do the other side. You have different sides to it, so just move over for a sec, give that side a break, and now it's fine again. So I'm gonna head back to it.